Good morning. Today we have invited Dr. Sujith Senaviratne, Associate Professor, Director, Cardiac CT Service, Interventional Cardiologist, Monash Heart and Monash University. Good morning and welcome to the studio, Doctor.
Good morning, Sally, and thank you very much for inviting me.
If you take the Sri Lankans and the Indians and the Mauritians as you were talking, is there a higher rate of heart attacks in these the communities that we're talking about?
Absolutely right. So what we think is that generally Indian, Sri Lankan, the subcontinent actually present about 10 years earlier than the Caucasian population. So it is more prevalent, and therefore you are at a higher risk. And to answer the question as to why, and nobody knows exactly why, but there are a number of possible explanations being given. One is that the population in the subcontinent have generally smaller arteries. Therefore, even if you have the same amount of cholesterol in these arteries, they actually lead to more impressive narrowings. The cholesterol distribution is also different. They have more diffused cholesterol, and often, therefore, these population may actually end up needing bypass surgery than stenting more commonly.
When you say diffused,
diffuse means it's more widespread. So often, usually we find a single location with cholesterol, maybe one or two blockages, and in the subcontinent, often there is more than one or two blockages, multiple blockages. So that's what I meant by diffuse.
Is there a natural chemical or whatever in your system to break down this cholesterol, or you have to take medication for the doctor?
There is always a balance between sort of cholesterol getting deposited versus cholesterol being taken away. So there is what you call good cholesterol and bad cholesterol. Good cholesterol called HDL, which takes away the bad cholesterol from your coronary arteries. While this mechanism exists, it doesn't always work and depends on a number of factors and most importantly genetic factors. So if you have a strong family history, then of course it doesn't help you. Diabetes is a very important factor, again more common in the subcontinent. High blood pressure, smoking is an extremely important factor. High cholesterol, obesity, physical inactivity, and of course, as I mentioned, different ethnicities have different risk levels.
And does the diet, do you think the diet contributes towards this with the ethnicity that you were talking about?
Diet most likely contribute. As to which component of the diet is not very clear. There's various theories about dietary factors. While we're talking about diet, perhaps it may be an opportunity to talk about what is the best diet that's been shown to reduce the risk of heart attack and stroke. And you know that if you use Google or any other modality to actually look up diet, it's very confusing. There are so many different ways or different diets being described. What I'm about to describe is what is actually being proven in a scientific way, what will reduce the risk of heart attack and stroke. So what you can see here is some information on the diet. Interestingly, there have been a number of trials looking at different diets, and one would think that it is the low-fat diet which is the clear winner. Interestingly, it is not the low-fat diet which is the winner, it is the Mediterranean diet. And I'm not saying that low-fat diet is bad. Low-fat diet is important and you should definitely follow it. But even better is the Mediterranean diet. And what are the two main components of this diet? One is extra virgin olive oil. We're talking about using it fresh, so ideally in your salads. You may use it for stir fry, but you shouldn't use it for deep fry because it has a relatively lower boiling point. And the second important component is nuts. Now, the three nuts which have been proven are almonds, hazelnuts, and walnuts. And doesn't mean that the other nuts are bad, but these are the three nuts that's been clearly shown to benefit you. Now, apart from these two components, what are the other factors or other components? Fish is actually better than any meat, and however, it has to be oily fish. So tuna, salmon, or sardines is the way to go. And chicken is the better meat as long as you take the skin out, and then of course any type of lean meat. We know that more fruits, veggies, cereals, all those things are good for you, and less trans fats you have, the better it is. So trans fats refers to fats you find in pastries, in fried food, in biscuits, and sometimes in cakes.
More carbohydrate based?
They're kind of carbohydrate based, but not necessarily all carbohydrate. They're fat.
Okay.
They're often found in these kind of food items, so particularly in pastries and fried food. So takeaway food and fried food is not good. But if you do want to deep fry, it's best to select an oil with a very high boiling point, and it is typically rice bran oil is a very good oil. And the other option would be to use canola oil. Now, another very important factor is to try and use plant sterols. Now, these are easiest to obtain through margarines, and you've seen it in the supermarket, like brands like Proactive or Logical.
Did you say margarine?
It is plant sterol, so it's a plant derivative, and it's presented as a butter or a spread. And as an example would be Proactive or Logical. And what they do is actually they bind to the fat or fatty content that you eat, and prevents the absorption of those fatty contents into your gut. And it can actually, in fact, reduce cholesterol by about 10%. However, you have to consume a reasonable amount of these spreads daily to get that maximum benefit. So that's pretty much the main dietary components.
It's a very limited area of diet you're looking at.
Correct. I mean, we know that in general, weight is an important factor. So in general, you stick to a relatively low-fat diet, and of course, carbohydrates, which is a common component in the subcontinent diet. Unfortunately, carbohydrates, rice and bread, are not ideal food. Particularly, they well known to make you gain weight. So I think ideal to keep the carbohydrates low, stick to this kind of Mediterranean diet, and that have been shown to produce the best results.